Thank the Cabinet Secretary for that response. Last month, the Progressive Economy Forum published findings that UK government austerity policies have lost £540 billion in public spending since 2010. Compounding research from the University of Glasgow, which showed that people across the UK are dying younger as a result of austerity, with people in the poorest areas being hardest hit. Over the past 200 years, there's consistent improvement in mortality rates up until 2012, when, in fact, life expectancy reduced, specifically for people living in poverty. How does the Minister feel that he might agree with this being completely unacceptable?
Cabinet Secretary.
Well, Presiding Officer, many of the health inequalities that people suffer that result in premature death are as a result of social inequality which they experience. And that social inequality is largely driven by financial inequality within our society. And the research, for example, that the member made reference to, which was by the University of Glasgow and I think the Centre for Population Health, highlights very clearly the very close association with austerity policy and the impact that it has on social inequality and then directly into health inequalities. So there's absolutely no doubt about the evidential link that exists between austerity policies that are being pursued by the UK Government that have a direct impact on life expectancy. That's why the measures that we take forward in tackling public health have to be closely linked to tackling social inequality. And that's why the measures, for example, in the debate we had just yesterday in this chamber, and the measures that we can take forward in order to reduce child poverty, which are systematically undermined by austerity being pursued by the UK Government, that as a consequence results in greater social inequality and results in reduced life expectancy. So as the academics have highlighted, it's very clear the link is between austerity from the UK Government and the impact it has on life expectancy.
Brief supplementary, Paul Sweeney.
Thank you, Deputy Presiding Officer. May I welcome the Cabinet Secretary to his new role. Data from Public Health Scotland shows that the overall risk of developing cancer is 30% higher in the most deprived areas of Scotland compared to the least deprived. And that is just one example of deprived communities paying the harshest price of health inequalities. Data shows that cancer, drug deaths and alcohol-related admissions are all more prevalent in these areas. So can I ask the Cabinet Secretary how he will prioritise prevention in his new role to tackle the root causes of the multitude of health inequalities that have occurred under his government?
As briefly as possible, Cabinet Secretary.
Presiding Officer, the member raises a really important point, and as I go back to the point I was making about social inequality being one of the major drivers of the health inequalities which we experience in our society. So some of the funding which we're providing for Inclusion Health Action is about supporting the GP practices that are working with patients that have got the poorest outcomes because of these social inequalities, to give them more time and support to be able to work directly with this patient group. So, for example, in the deep end practices, the additional capacity they have to support them, to try and tackle some of the negative outcomes that patients experience as a result of public health challenges that they require. But alongside that, all of the other measures we're taking in terms of reducing smoking, promoting smoking cessation, making sure that we're reducing the level of alcohol intake, all of these public health measures play an important part. However, these measures can only take us so far unless we tackle what is the endemic problem of social inequality. And the root cause of that is austerity that's been perpetrated by colleagues over on that side of the chamber in Westminster.
Question 6.